Welcome back to the Bulletproof Backs channel. Following on in our movement videos, I'm going to talk to you a little bit about hips. And I'm going to start at the feet because what the feet are doing is a reflection of what's going on up at the hips. And once you can get the visual on that and understand how it's affecting the way you move around your pelvis, which affects how your back moves, there might be some little tips I can share that will help. For those of you who don't know me, my name's Marion McRae. I'm a physio, psychedelic assisted therapist, Pilates instructor, postural neurologist, fascial therapist, lots. But none of that matters if I can't condense some of what I know and give it to you on a platter so that you don't have to be stuck in this back pain cycle longer than what you probably already have been. And I share all this stuff because having been in the industry for nearly 30 years now, I just see a lot of missing information. And I want to plug those gaps. I want to make what I know more widely available so that people like you can get on with the job of getting better so you can get back to being your best version of you. Because I know how back pain saps the life force out of you. And I know there's a lot of you that are trying everything and getting nowhere. And people like you, my heart goes out to you. It's simply because you just haven't come across what you need to hear. And hopefully the missing part for you is somewhere on my YouTube page. So if these movement videos aren't kind of dialing up, they're not resonating, hit the mental mindset videos, hit the emotional intelligence videos, think about your pain holistically and just tap into whatever you feel is the missing part for you. Today we're talking about hips. Now hips matter because the hips sit in sockets on which your ilium, which is part of your pelvis, move. So if I have a hip that's not centered neutrally, then it affects how the ilium moves, which affects how the pelvis moves, which as we know by now affects how your lumbar vertebrae move. So here's some little descriptions. How do I know what your hips are doing? Sometimes I look at your feet. So often I see people come and stand and I say, just shoes off, let's stand, let's notice what we notice. And I might see, these are the common ones. I might see this, which definitely affects how I can move my pelvis. It limits it. So if I've got wide legs, my ability to kind of move my pelvis from side to side is limited. My ability to kind of tip my pelvis forward and back is much more limited, which means then my spine has to work and move excessively, which might be what keeps it in pain. I see this, which again limits what I can do in my pelvis. I feel very unsteady. I can't move my pelvis very far in any direction because the base of support is so narrow. So if I was reaching for something to the right, I would have to throw my pelvis left and really get a big spinal motion to get what I need to get. That overreaching through the back could be simply what's keeping it active and overstretching something that's trying to knit and be stable. So where I put my feet matters. If I tend to be this, again, I can't access much motion here because I've taken my hips into full external rotation. I've particularly limited the ability to forward tilt. In fact, I've got no forward tilt or very minimal forward tilt there now, which means I can't get much pelvic movement in the sagittal or side plane at all because my hips have locked my pelvis. Similarly, if I wind them all the way into internal rotation, it's a very similar story. I still can do it, but I'm quite mobile, but I really have to work at getting any of these motions. Your hips most likely going to be a little bit tighter, and if you just play with that, just turn your hips out, turn your hips in. I'm saying you can see it's the feet. When I turn the feet out, I turn the hips out. When I turn the feet in, I turn the hips in. Play with those two positions and try and do a forward and backward tilt and feel in your own body the limitations. And then put your feet back in the middle and just try the movement again and go, oh, geez, that feels a lot easier. I can access more motion when my feet and hips are in neutral gear. It's a bit like moving your accelerator or moving your gear stick in the car to full reverse and then trying to reverse. You'll go a fair way, but if you try and go forward, you just won't be able to go anywhere. You're just biasing movement by locking joints. Jiu-jitsu is a great sport to experiment what it's like when you lock one joint, how you just literally can't move other parts of your body. So watch your foot placements. We don't want too wide. We don't want too narrow. We don't want two turned out. We don't want two turned in. We don't want one out and one in. That's really common. That's one of the biggest ones is I stand, I have my left one out, and I side shift into my right heel of my right foot. That's a really common stance position I see a lot, which creates groin pressure here or groin length here, creates a lot of hike, a lot of compression in the right side of my back, a lot of dropping on the right side of my spine. I get heel pain on my right foot. You get the picture. Learning to spend more time centered with our pelvis centered on our feet is possibly one of the most simplest and easiest ways to start to encourage better spinal motion in your back. So yeah, play with your hips. I'm going to harp a little bit about glute strengthening because I can't help myself. Let's say you have the best glutes ever, your buns of steel, and you come in to see me with back pain and you're standing with 1 foot out and 1 foot forward. I know, just by looking at your placement, you have some significant shortening, lengthening issues of piriformis, psoas around your back. They're really important muscles around your back. And you may have amazing glute strength, but geez, it's not helping you. It's not helping your back because the way you're moving is creating unnecessary asymmetrical forces through your vertebrae. And you cannot strengthen your way out of poor management of your mass, poor management of your center of mass, which is at L4-5 in most people. If you're not managing the force distribution with quality movement, then I'm not a big believer in strength. Strength is really important if you're super elastic, super hypermobile. We need to improve that collagen density to get some sort of strength and consistency in holding through the key joints of stability around your pelvis. But that's not a lot of people I see in pain. It's some, definitely. So just be mindful. Is what I'm choosing to do for my back the most impactful thing I could be doing right now? You want impact, you want efficiency, you want to be dealing with the major issue as much as you can and not loading yourself with 100 other things to do to improve your back that aren't really going to bring much to the table. Again, just my opinions. Happy to share them. Hope they help. Let me know if they don't. I'm sure you will. Ciao for now.